Modern medical science has done wonders. Many of the diseases that once threatened our communities are gone. Life expectancy is greater. Many types of cancer are curable. And our overall living conditions have improved, but there is still so much more to do. Asthma is on the increase. Pollution is more concentrated. Obesity is rising. Diabetes is climbing. Stress and respiratory disease are pervasive. And anxiety disorders or depression impact 1 in 5 adults. Yet part of the solution is already here because science has found the data that ties trees to better human health.
The idea that there's a link between trees and health is not new. It's as old as human history.
When we talk about health, your zip code is more important than your genetic code, and it's way more important.
Trees connect to human health and well-being. They also help to remove air pollutants, reduce stormwater runoff, reduce energy use. It just took a while for science to catch up, and now we've got data to prove it.
It has always been assumed that trees are good. What's been missing is scientific proof. At the Sacramento Tree Foundation's annual Greenprint Summits, national, state, and local health experts gather each year to present their research. Studies are explained, data is reviewed, and their findings document a clear link between trees and public health.
What we know from many studies now is that the biggest determinants of health outcomes are the environments in which people live, learn, work, study, play.
We found that increased neighborhood tree canopy was associated with self-reported better general health.
We really found a direct, statistically robust and significant relationship between the amount of tree cover within about 400 meters surrounding each of these monitoring sites and the specific reduction in this nitrogen oxide pollutant that we were looking at.
Exposure to trees improves our psychological and cognitive function, so our minds work better.
Simply viewing a green space has been shown to reduce blood pressure, heart rate, and to lower your cortisol levels.
Cortisol is an amazing chemical that helps us respond in a really dramatic fashion to stressful events. The problem is, if you have chronic stress, you are at risk for getting sick more often, for staying sick longer, and for dying sooner than your colleague who doesn't have as much stress as you do.
We also found that the greater the neighborhood tree canopy, the less likely that children, teens, and adults in the sample were to be overweight or obese.
The tree canopy mattered as much in this prediction as household income or education level when predicting an individual's social capital.
There's no question in my mind and those who collaborated on the study that there is an inextricable link and association between better health in many dimensions and more tree cover.
Today, the body of evidence is rapidly growing. The diagnosis is confirmed. Trees are a practical part of the prescription for the public health challenges in the 21st century. Public health is everybody's business. Trees are a prescription for better health. And by working together, we can grow the nation's best urban forest.